Joining us this morning, our friends from Titusville Area Hospital. Holli Wolfe joins us. And Holli, you brought in a special guest this month.
Good morning, yes.
Good morning, how are you?
This is Lara Johnson. She is a physician assistant that we just hired at the hospital. She'll be working at our new office in Tionesta. So we're opening an office in Tionesta. It'll be open Monday, Wednesdays, and Fridays to care for those folks down there. So we're pretty excited about that.
Very nice. Well, welcome to the program this morning.
Thank you.
Tell us a little bit about yourself.
Well, born and raised here in Titusville. Grew up eating lots of Italian food at Papa Carone's and playing softball and a little bit of tennis.
Thanks for throwing that in, by the way. Yeah, softball star, but early beginnings as a tennis player.
And then I went on to Slippery Rock in athletic training and eventually found my way to Lock Haven for a degree in physician assistant. And now I'm here.
Wow.
About ready to start in Tionesta. Really excited.
Congrats.
Thank you.
So tell us about your softball career. I mean, you played under the great Jim Becker.
I did. I was a couple of his...
Whoop-de-doo.
How many wins did he have? I don't know.
How many wins did he
100?
have?
Yeah, I don't know. I was part of a couple of those.
Nothing to do with him, though, right?
Yeah.
Just you guys,
was
the talent.
Yes. Yeah.
And that's why we're bringing that talent to Tionesta.
Yeah, there you go. Nice segue, Holli.
Any
Nice
sports
segue.
injuries or anything?
Well, talking sports here, I mean, sports plays a big role here in Northwest Pennsylvania. We do spend a lot of time talking about it, but it's a big thing for the community.
Yeah. Yeah, and I mean, not just actual sports like softball. There's things that other people enjoy, hunting, fishing, and, people could get a hook in the finger, Right. I mean, there's tons of different things that...
Black guy from a softball, maybe.
Yeah. There's lots of...
Holli doesn't want to bring that up.
So,
but you're right, and we're coming into those months too, where people are going to be out enjoying the outdoors and biking and swimming, and I mean, there's just a lot of fun things to do. But sometimes something will happen. You're
right. Yeah. So we're really, really excited to open that office. It's been since 2014 since anyone has been in that office.
Really?
So yeah, it's been a long time. The community is so excited. We've been working with. There was a committee, a community health committee in Tionesta that kind of pulled together, and they reached out to us and asked if we had any interest, and we've been working on it for months, trying to get everything ready and getting ready to launch it. So we're going to be opening April 10th, and then we're also going to have an open house on April 10th as well. So we're pretty excited about that. We'll have a ribbon cutting ceremony. It'll be the open house will be from 4 to 6. The ribbon cutting ceremony will be at 5. The school, we've been working with them as well. The superintendent and the school nurse was part of that health committee, and so the FCCLA will be baking cookies for us, and so the students
no carrots.
No carrots. We're having cookies, yes.
Okay.
Believe it or not. I'm letting this one slide. We're allowed to have cookies at this open house.
Long story.
Yeah. Yep. It is. So we're hoping, that we have a lot of people come, and everyone in Tionesta has been so excited. I've received calls at home and text messages about, when it's opening and, how they can transfer records and things like that. So I'm really excited, and we're hoping that once we get started that we'll be at full capacity at 3 days and that we can extend our hours. But we'll cross that bridge when we get there, and hopefully it'll happen. We'll be able to be full time down there. But for right now, we'll be Monday, Wednesday, and Fridays.
Great pictures on the poster there.
Yeah.
So what sort of challenges does that bring for you? Is this kind of fun to be able to get out and do some traveling?
Oh my goodness, yeah. I'm really excited just to help the community in an area where they really, like she said, haven't had anybody there in a couple of years. So really just getting people the care that they need, but definitely facing the challenges and the people that haven't had care. But I just hope to be able to do a lot there.
And Holli, when access isn't readily available like that, people have a tendency to say, well, I don't really need to go, or I haven't been feeling well, I know I should probably get checked, but I'm not going to travel.
Right. And in fact, they did a survey. So there was a survey that the school did, and it was community-wide, and students went around and, literally did paper surveys. You could do it online. And, the response was that a lot of people use urgent cares because they just, they aren't able to travel. And so they wait to the very last minute to seek that care. So, and one of the questions was if there was somebody in Tionesta, would you use them? And of course, people are, happy about that. So, and we're also going to have Dr. Gador down there because it seemed like there's a lot of kids that need care as well. So Dr. Gador from Oak Street Pediatrics, she's been with Oak Street Pediatrics since 2013. She's still going to be at Oak Street Pediatrics, but she's also going to see patients down at the office. Lara will be able to see all ages, but if there's some kiddos, especially little ones, we would like them to see Dr. Gador first, and then can do follow-up visits and stuff with Lara. So it'll be a great addition to have her down there too. So.
How soon can folks start making those appointments?
They can start calling as of April 1st. So it'll be a few more weeks, but they'll be able to start calling as of then. The number is 755-3631. So it's actually the same number that they had in the past. So
wow, okay.
Yeah, so
those old magnets
should still have yes, yeah. And in fact, there'll be a mailer sent out to everybody in I think 5 zip codes this week, and there'll be another magnet stuck on there so they can put it on their fridge, and they'll have the number. They'll have it handy. So yeah, and we're hoping to we'll be able to take walk-ins at first as well too. So people that are in the community or something like that, and it comes up, we'll be able to do those. Of course, we'll just be able to fit them in as the schedule allows, but appointments, of course, are always preferred, and that way nobody has to wait. So.
Now, for those, and we are on in Tionesta, by the way, so good morning. If you want to say hi. Hi, Tionesta. If folks aren't familiar with the location, how do they get there?
Yeah, so Tionesta is not real large. I can't say at the first stoplight because there are none.
Nice.
But,
and we like it that way.
That's right. Yeah, and I live in Tionesta, so, I love it there. Obviously, I've lived there all my life.
Somebody's like, there may not be a red light, but there's a stop sign, Holly, and we've seen it.
Yes, they've seen
that car's got a rock when you stop.
So the location is at 111 Bridge Street. It's just off of Elm Street, which is the main street going through Tionesta. And as of today, there'll be a big banner hanging down the street,
nice.
Just to let people know about it. I've been hanging flyers, so people are aware, and there'll be a press release going out next week in the Forest Press, and there's been some ads in there as well. So, and the school's been absolutely great. They're sending information home with the kiddos to let parents know, and so it's gone very well. Everyone's been very supportive.
And again, sort of a fun challenge for you, right? Because you'll get to do a little bit of everything.
Exactly. Yeah, should be fun. Yeah, the preventive stuff, just keeping people healthy, catching people up, all that.
At what stage did you know that this is what you wanted to do?
I was thinking about that as we were driving here this morning. And as odd as it sounds, I think Mr. Rapp's biology class, dissecting a cat in 11th or 12th grade, or whatever it may have been. I love that anatomy portion of things so much that I knew that medicine was where I had to be, and it just kind of all evolved from there. But
so while everybody else is in the corner,
yes,
shying away,
yes,
you're in there going,
yes,
bring it over,
yes. Bring me another cat. You got a brain anywhere?
Yeah. Well, sometimes and I just heard a story a couple weeks ago where they were talking about trying to get rid of that stuff in biology class.
Really?
Yeah.
Oh, wow.
Dissecting frogs, or cat, whatever.
Yeah.
Well, it's
That's
not humane. Yeah, but
Yeah.
I'm thinking here somebody's inspired by that and saying, boy, I would love to do this.
Yeah.
And
that's a shame.
that's what you are doing. Yeah, and I don't know if it'll happen across the country, but this was like an isolated thing.
Wow.
It's 10 minutes to the top of the hour. This is the Morning Drill. You're watching it on Stream Television at Armstrong and listening to it on the Allegheny News Talk Sports Network. Well, Holly, some big events coming up in April. That's wonderful and very, very exciting.
Yeah.
But we're not quite done with March yet.
No, not yet. We're midway. And we have, next month, so we're going to talk about Donate Life Month as well.
Okay.
So next month is Donate Life Month. And
I don't want to donate my life yet.
well, right. I understand.
Okay.
But to be an organ donor
Right.
would be great. You know, that little put it on your driver's license. So, and we're going to have some folks here next month talking about that because I will be on vacation. I know I will be very missed and everyone will be sad. Tune in, I won't be here, but I'll have some other great folks filling in for me to talk about Donate Life Month, and we're going to have an event at the hospital on April 12th. We're going to do it's a Friday, I'm sorry. We're going to do the flag raising ceremony like we did last year, and don't yell at me, but we're going to have cupcakes, blue and green cupcakes, because it'll be Blue and Green Day that day, and that's a national thing, so we'll be doing, we're going to have hospital staff do some handprints and things like that, and then we'll display those throughout the hospital. So it'll be a pretty cool event, and we're going to have the public come. I believe a representative from Donate Life will also be there to kind of just talk to the crowd a little bit about, what they do, and we might also have a donor, a family member, or something like that, a recipient. So they'll be able to give their experience too. So it'll be a nice little event. Again, it's on Friday the 12th from 11 to 1, and then the flag raising will be at 1 o'clock.
I was just at the DMV over the weekend, and they had a slide that came up, and it was like one person can save
8 lives.
Yeah, it's incredible.
It is, because those 8 organs can go to somebody else. And, there's a lot of things that it's out there that, people think that I'm too old to donate, or, they're not going to save me, or, something like that, because I'm a donor, or, and it's just not true. I think people up to age 90 have donated. So, they might still have a really good, strong set of lungs, or, something like that. So, you can donate, or their tissue, they can donate at any age. So, yeah.
And March
is Colorectal Cancer Awareness Month. So Dr. Rogers, he's our general surgeon at the hospital. He, of course, does many things at the hospital and does colonoscopies. So, of course, you can have that done at any time at the hospital. But, we just like to kind of raise awareness, and colorectal cancer is the leading cause of cancer-related deaths in men and women in the United States. The third leading cause, and so it's kind of high up there. So, to have a colonoscopy to make sure that there's nothing going on is a good idea. Now, the American Cancer Society previously had recommended starting those screenings at age 50, but they've lowered that this year, so they're recommending age 45. Yeah, because they're finding younger folks with it, so that it's starting a little earlier. So the recommendation is now 45, and if you have it at age 45 and they don't find any polyps or anything, then you can have another screening in 10 years. So it's not something that you have to put a lot of time into.
Why?
It's not like you have to do it
Why
all the
10
time,
years?
but
That seems like a long time to wait. I mean, couldn't something happen in between, or does it take a while to develop?
Yeah. Honestly, I believe that it must take. That's
about 10
not
years.
a good. Not a good question
Does it?
for me.
Yeah,
but,
that's why the interval is 10 years like that.
But
some of the polyps, though, some can be more aggressive, and if they find a polyp, then generally they do it again in 5 years. But if you're clean, then the thought is that a lesion won't pop up and it won't grow too aggressively over the next 10 years, so you can wait 10 years.
So let's say you wait 10 years and they discover, you have it. It would not be...
Shouldn't be too far along.
Okay.
Yeah. Usually,
and I realize that could be
treatment.
different.
Yeah. Some local treatment as a cancer. A surgery to resect it is usually.
Are you finding that when somebody hears cancer, that it's not an immediate death sentence?
Yeah, colon cancer too, and that's why the colonoscopies are so important.
Is that what Alex Trebek?
Early.
No, he has pancreatic
He's
cancer.
pancreatic.
Oh yeah.
Yeah, that's a little
Yeah.
more deadly. Is that correct?
Yeah. That one's a little more scary.
Okay.
Yeah.
But I'm sorry, you were saying.
The colonoscopies, if found early enough, generally, and I'm not an oncologist by any means, but surgery at first, generally, when it's found early, can usually be very successful.
And again, Holly, for something like this, folks just need to schedule that appointment or sit down with the doctor. And during the course of that conversation, just say, hey, I'm interested in getting this checked.
Right. And a lot of times, your family physician or someone might talk to you about it anyway. But, you should definitely be proactive, and have it done. Of course, it takes a whole morning, and you have to do prep and things like that. And some people are scared of
that's the worst part, though, right?
The
prep part.
Yeah, I had a patient tell me once though that she actually enjoyed it because she fit into her skinny jeans again.
See, there's perks to everything. Everything.
Yeah. Well, that's what I hear. It's like, just the prepping for it's the absolute worst part of it. But
so you spend the day not enjoying it, but then you get a peace of mind for another 10 years.
Exactly.
But and that's it
big.
exactly. Yeah. Are there any warning signs that, hey, this might be something I should be checking out like now?
So a lot of the times blood in the stool can be a sign, but a lot of the times it'll be too dark to really notice. And that's really why the screening is so important, because a lot of the times there's no symptoms associated with it until it can be too late.
Okay. Holly, a lot of great information as always, and there's just a lot going on, a lot of excitement.
Yeah, it
so
is.
Let's recap what's going on. Of course, this month, Colorectal Cancer Awareness Month.
Yeah. Yes, and next month we have the open house at Tionesta, so that'll be, again, April 10th. It's a Wednesday, and that'll be the first day that we'll start seeing patients at that office as well.
Do they need to RSVP for that?
Yes, and they don't have to RSVP, but they can RSVP. The information is on there. They can call the hospital, and then they can be transferred to my extension, Holli Wolfe, or they could call directly 827-8717 and to RSVP. But like I said, it's not necessary, but it's just good to make sure we have enough cookies for everyone, right?
Go and reference the Christmas interview.
But Dr. Gador will be there, Lara will be there, Dr. Whalen will be there. So it'll be really nice for people to see the office and be able to meet them, and that'll be a good thing.
It's fantastic to get that reach. And again, this is the Tionesta Health Center, and it'll really connect those folks to here, and that's wonderful.
Yeah, and we'll be able to do blood draws there too. So it'll be great for them to not have to travel to have their blood work done and things like that. So the nurse that's going to be down there, she's a local girl as well. So Christy Black. So she's going to be very familiar with a lot of the people that'll be coming in. So that's nice too. Yeah.
Thanks for your time. Congrats.
Yeah, thank you.
Did you learn anything today?
I learned how great of a softball player Holli is.
Holly, did you learn anything?
Well, I learned that Punxsutawney Phil, he's needs to get up his game a little bit because it is spring, and he said early spring that didn't happen, and now we're gonna have snow.
It'll be nothing. Just dusting tomorrow.
I know. So I'm not really trusting his word anymore.
Thank you.
Thank you.
Tell you the story.